Good morning, good morning, good morning. Good morning. How are you doing? How are you doing, guys? Good morning. Today I have a different kind of today I don't know why this my screen always frozen. Today I'm sharing a different kind of posts. As you can see, I'm sharing with some of the groups, and you can share too. Today I'm talking about the pre-existing conditions. You know what I'm talking about. Pre-existing conditions. How are you guys doing anyway? With all this COVID-19, how are you? Those of you who have pre-existing conditions, diabetes, high blood pressure. Let me give me a second, guys. I'm tagging some of my favorite groups. Keep tagging your friends, guys. Keep tagging your friends. Let's share this. Let's talk this. Let's share this, guys, before I go to work. Let's do this. Let's do this, guys. Let's do this. We can do this. Let's do this. I am sharing this. I'm sharing this. Okay. I see I have around 14 people. I'm gonna go because I'm going late. I'm late to work. I've gotta go. I had a day off yesterday. It was so nice. I'm telling you. Working. I was trying to clean up. Ooh, I love Kenya. I love back home because people have maids and they can enjoy. Here, the struggle is real. I don't care what you are. Unless you get somebody from outside, a professional, to come and clean for you. Something on it too. Clean for you. The struggle is real. You have to do it. You have to clean yourself, cook yourself. Whether you are a doctor or not, you have to clean, cook, do everything. When you come to the door, all those titles have to stay outside. You have to be a wife, be everything. But anyway, have you talked to your friends? Today I am talking about, first of all, before I talk about pre-existing conditions. During this COVID-19, we have people who have pre-existing conditions, meaning you have diabetes, you have high blood pressure, you have HIV, you have lupus, you have rheumatoid arthritis, you have cancer, you have gone through surgery, you are back home. You know, things did not stop. People did not stop being sick because there was coronavirus, because of COVID-19. People who have pre-existing conditions, people who have, let me close this door, people who have sick, they are still sick, and if God forbid they have COVID-19, they have to know how to survive through that. And that is what I'm going to talk about. I only have 10 minutes to talk about this because I've got to go to work. I should be work at 10. So, first of all, the Minneapolis family who lost their loved one, I'm not going to mention names because of privacy. We are praying for you. The person died through COVID-19. He was a PhD doctor holder. We are praying for you. We are with you. We are praying for Minneapolis families. We are there for you, praying for you. So that brings me to talking about the pre-existing conditions. People who have pre-existing conditions. How do you survive through this coronavirus? Whether you are in Western countries, USA, whatever, UK, Australia, you are back home. How do you survive with the pre-existing conditions? I'm just going to give you a quick, like overall with the pre-existing conditions you have. For example, people who have diabetes, how do you survive during this time? What if you get sick? What if you don't have your medication? For me, I believe that this is the time, anybody who has a pre-existing condition, this is the time to be very, very careful. This is the time you need to continue wearing your mask. You need to continue wearing your mask every day. You need to wash your hands. You need to keep social distancing. You have to. This is for you. We have people who are so careless out there who don't wash hands, who feel like they won't get sick, especially the young people. Yesterday we went with I was somewhere and I called my son to come to the store and I saw he didn't have a mask. I told him to go right back home. And he's an older boy. I don't play those games. So, but you know, you're not going to tell your neighbor, your workmate, you're not going to tell them to wear a mask or to wash their hands. So as a person who has a pre-existing condition, you are going to protect you. You are going to do whatever it takes to protect you. And that brings me to washing your hands, keeping distance, and having your mask. Now in back home they have masks, and for you, especially if you have a pre-existing condition, I will not, if you can afford to get a real good mask, the real good mask, not the cloth mask, the real good mask, if you can even buy one good one like the N95, you know, a good mask so that you can wear, especially if you are going far, unless you are around your home. The other thing is for people who have diabetes, if you get to be sick, you know your sugar goes up. So you need to check your sugar, and if it is up, you need to either call your doctor. Sometimes your doctor will tell you to increase your sugar. You know, some of you know how about sliding scale, how you check your sugar, and it goes with, if your sugar is over 200, you're supposed to take 4 units, things like those ones. So call your doctor. Usually they will tell you to increase, because you need to know your disease. You need to know how to maintain your disease, whatever your diagnosis you have. That is very key. And that, before I go to the next, you know, person who has a different pre-existing condition, diabetes is so easy to manage if you learn, you yourself as a person, you learn about your disease, because your doctor is not going to be your home with you for a whole month to know what you're eating. He is not going to be with you to check your sugar. You have to learn as a person, and you have to be sincere and faithful to yourself as a person. The biggest problem we have, I see, with people who have diabetes, they lie to you. Oh, doctor, you know, I've been doing well. Today my sugar is this. You check their A1C. A1C tells you somebody's blood sugar, what they have been eating for the last 3 months. You find it is 13. You know, that is so high. And they are lying to you. The normal should be like anything below 6. So they are 13. You know that is bad. So what I'm just trying to say is that as somebody who has diabetes, you know yourself, diabetes is a carbohydrate disease. So like those ones who are back in Africa, you have no business eating white ugali, white flour ugali. You have a business of eating the black one, the black ugali. You know what I'm talking about, the wimbi ugali, because that is, it is high in fiber. It doesn't digest so fast, and it will keep you full, and it doesn't raise your blood sugar as fast as the other one. So you need to know that if you're in the village, that is the kind of ugali you're going to eat. No sugar stuff, no simple carbohydrates. You know, those are the basic things you need to keep while you're in the village, so that you keep your sugar until you go to see your doctor. It is simple as that. Keep taking your medication. If you're taking your metformin, just keep taking the way you're taking. Eat the same, almost the same food every day. That will levelize your sugar. It's very important. That is especially people in the village. The ones who are in the cities, the ones who are here in USA, Canada, whatever, you can do the same. But for you, you have leverage. You can call your doctor. There is no reason you are in USA, you have blood sugar issues, and you don't have a glucometer in your house. You're crazy. You have to have a glucometer in your house. Check your sugar every day, because that way you know your levels. If you are using Lantus, the long-acting insulin, for those ones who use insulin, you will know if you keep a diary every day about your sugar, you keep a diary every day, you will know the levels of your sugar. And you will know when your sugar is high, you know when your sugar is low. When you are sick, you will know how your sugar is going to go. And that is what I'm going to say with diabetes. What about high blood pressure? High blood pressure, they call it a silent killer. You are supposed to be checking your blood pressure. If you have, nowadays they have that small cuff thing. You can buy it in CVS, the ones who are in USA. Buy it in CVS. Check your blood sugar, check your blood pressure every morning. It might not be 100% accurate, but it's going to give you a good, at least a good lead. So check your blood sugar, your blood pressure every day, and take your medication. One thing I want you to know, sometimes, unfortunately, and I'm going to give it for you for real, unfortunately, medication that sometimes works for black people doesn't work with white people because of their kidneys and the way their kidneys function. I won't go to details. So for us, when you are talking to your doctor, ask them, does this work well with the black people? Sometimes that's why you should see sometimes your black doctors. You always want to go to white people all the time. You don't want to go to your black people. Some of your, like in Minneapolis, I know we have good black doctors. They're from Africa even. So sometimes we know, I'm not saying white people don't know, they know, but that's for another day. So check your blood pressure every day. Also, you will know if your blood pressure is those blood pressures that are uncontrolled. Make sure you ask your doctor if clonidine or Carbohydrate is something you can have, because Carbohydrate brings your blood pressure quick down. If it's those people who have blood pressures who are in 200s, over there crazy where you can easily get a stroke, always ask your doctor, can I have Carbohydrate just in case? But the problem with Carbohydrate, especially for childbearing years, it lowers your libido. Sometimes that's why you find men have a problem taking blood pressure medication, because one of the side effects is sometimes it lowers your libido. And sometimes if I know some of my patients tell me about that, and I've read about that, and I know about that. So sometimes ask your doctor, is this blood pressure medication I'm taking, can it lower my libido? Especially people are not so old in my age group, in your 40s. You wanna keep it going with your wife, because women in 40s is when they are they're crazy. So what I'm saying is that ask your doctor the kind of blood pressure medication they are giving you. Does it affect, is it the one that can affect your sexual whatever? So that would also help you. As I said, clonidine is one of the best medication to lower the troubled blood pressure, but ask your doctor. I am just giving general information here. What about the people who have cancer? For people who have cancer, your immune system is so low. So you have to avoid running around. This is during COVID-19. You are the ones who are going to the store to do a little shopping. Your immune system, because you have been on chemo, you have been on radiation, you are taking, maybe you are already, your numbers look good and you're feeling good. You can walk around your backyard, but you should avoid going to gatherings, because your immune system is compromised, guys. So if you recently had surgery, you had a surgery because of cancer, you had surgery because whatever reason, you need to keep it, and you need to eat foods that are going to boost your immune system so that your immune system will come up. And one thing I always tell people before I forget, everybody, look at me, let me tell you, you look at me, somebody was telling me, Dr. Pam, you look so beautiful all the time smiling. Honey, I also have problems, but I've managed to deal with my problems with grace, okay? I have problems. Nobody doesn't have problems. you have diabetes, another person high blood pressure, another person is going through chemo, another person is going through HIV. Everybody has a problem out here. Nobody has a problem-free moment. It's either you're in a problem, you're just getting out of a problem, or you're going next to, you're just entering a problem. That is what is called life. So you just have to learn to deal with it. So going back to cancer, those people who have cancer, please keep drinking, ensure, because sometimes you don't have appetite. Sometimes those chemo medication may make your mouth, inside your mouth, have those sore throats. You can't even eat well. You are nauseated. Be your own advocate. You are nauseated. You can't even eat. Call your doctor. We give Sofren. We give Sofren. It will take the nausea away. Let them prescribe for you Megates. Megates will help you deal with like give you appetite. Be your own advocate. Advocate for yourself. If you don't feel well, call them. This is how I'm feeling. You have alopecia, meaning you don't have hair drops when you go for chemo. We have groups and associations here in America that will provide nice wigs free. Google. Let Google be your friend. Know those resources that are available for you. And also, join groups. We have groups that are... Why am I hot? We have groups that have associations that you can join. If you are a cancer survivor, I see you, Harriet. If you are a sickle cell survivor, we have groups you can join. They provide information. They would even provide food. They would provide wigs here in America. Groups, because they are given, that money is given free to them. So they are supposed to provide to their patients, cancer patients, that is what is supposed to be. So call your doctor, ask for those things. What about patients who have HIV? You know, HIV is not a death sentence the way it used to be. But that doesn't mean you'll be like Jalango all over the place, Jalango is going to kill me. All over the place, doing things without even using protection. What I'm just saying is that there are so many ways you can get HIV. Sometimes women or men, you're sitting in the house and your spouse brings HIV. You are not going to be miserable and go into death because you have been diagnosed. I know it is crazy. I know it is like a death sentence. But you know what? Sometimes cancer kills people before HIV kills people. Hello? So you need to, once you get diagnosed, I know there's anxiety, there's everything, but you need to take a breather and ask yourself, what is the next best thing can I do so that I can protect myself? Because now we have HIV-1 and HIV-2. So if you have HIV-1, you want to protect yourself from not having the HIV-2 strain. Because if you have HIV-2 strain, now you have two kinds of HIV, your immune system is not going to fight for you the way it is supposed to fight for you. Keep tagging people. This information is not the crazy information I was talking about yesterday. This is good information that can help somebody. Tag people, share in groups, share in WhatsApp, share in Instagram, share whatever. Share everywhere. Dr. Pam, your friend. So, as I was saying, the people with HIV, you need to take your medication. Nowadays, for people like USA, one medication, you're good to go. You take it in the morning, you're good to go. You also have to follow up with your doctor. Check your Cd4 count. What is your Cd4 count? Because your Cd4 count, if it is undetectable, you are in that good level. Meaning undetectable, meaning they cannot see it. It doesn't go away, but they cannot see it. So you also, just like somebody who has cancer, you also want to avoid places because your immune system is compromised. You also need to wear your mask. You also need to wear your mask so that you don't get infections from other people. You also need to eat healthy foods that will boost your immune system. You need to live a good, stress-free lifestyle so that you can continue living a long life. People live with HIV 30 years. Magic Johnson, you know that Magic Johnson, the basketballer, 30 plus years. So it is all in the mind. Anything, whether you have cancer, you have HIV, you have diabetes, it is all in your mind. We have this one of my mentors, Bob Proctor. Bob says that your mental status, your faculty, how you're thinking, whatever you're putting in your subconscious mind, what you're telling your subconscious mind, that I'm going to be well, that this HIV I have, I am going to manage it. This cancer I have to heal from this cancer because this is not for me. Guess what? You tell your subconscious mind that is what is going to happen. Your subconscious mind is going to work for you. It all starts in your state of mind. Because the more you think about it, the more you say, I am going to be well. I am going to fight this disease. I am going to win. I am a winner. This is for me. I mean, God, I am living in this world. I have so many things to do. I have to raise my children. You keep on giving, they are called positive affirmations. Positive affirmations. That is not the time you are saying, oh, I am dying. Oh, I am suffering. Oh, you're calling everybody. You are being miserable. You are being bitter with your children, with your spouse, with everybody around you. People don't want to be around you because you are diagnosed. No, you don't have to be that. Okay? You don't have to do that. Because guess what? Once you set your mind that you are going to be well, your body is going to fight for you. Your body is going to fight for you until you feel well. So keep that in mind. Keep that in mind. W. Clement, one of my greatest motivator, he says this. W. Clement says this. Your positive mental attitude will take you places you have not seen before. It will take you everywhere. I'm asking you a question. What is your mental attitude about your diagnosis, about your HIV, about your cancer, about your diabetes, about your high blood pressure? I'm going to the next one. Quickly, I have to go to work. Quickly, anxiety. I know this is crazy. This time we are here is crazy because uncertainty, the people who have anxiety is going to the roof. I'm putting anxiety, depression, all those things together. How do you survive during this time? For me, I would say this, because I treat patients with anxiety all the time. I see most of them are telling, no, Dr. Pam, please, we need more medication. I'm like, you don't need more medication. You need to get outside your backyard and walk. You can do some exercises at home. You can listen to positive motivation. You can do things that will slow down your anxiety. Find something to do. Read a book. How many of you have been reading books? Get a nice book. Read a book. Have a project. How about even writing a book? Find something to do that will keep you busy. I see my son, my older son back here in my garage. He turned it into a gym. He made me one day to take all the junk. He's like, Mom, you have to take this junk out. Even the garbage man was like, oh my goodness. We took all the junk out. He has been constructing. He has been doing things in the garage. He's like, Mom, I only need $300. I said, here you go, $300. Because I know he's keeping himself busy. He's built a gym. I'll share for you. Let him finish. He's built his own gym, his own lifting stuff, his own bench for you know, those ones who exercise. Find something to do. If it is your house that has not been painted, if you have a little money, paint your house. Because most of you, and also get unemployment, guys. For those of you who are laid off, get unemployment. You can get that. As Africans, we are the last to get nothing to, even something you rightfully can get. You are laid off, you are just sitting there in your house, being miserable all over social media, cussing Dr. Pam out, oh, she's divorced, oh, she's what? I'm divorced, but I'm happy. Leave me alone. So, get yourself something to do. Otherwise, that anxiety is going to go off the roof. The people who have rheumatoid arthritis, lupus, osteoarthritis, what else haven't I talked about? Those of you, your knees, rheumatoid arthritis, the hands or whatever, you need to keep them busy. Keep them, your hands working. Because the more you use them, even if they hurt, at least the joints are going to be flexible. Don't be sitting watching Maury, what is her name? I don't watch TV anyway. Watching all this crazy Empire, whatever, all those shows you watch. Me, I don't watch TV. Instead, I read books or listen to something good. So, or doing my project. I have so many things to do. So for those of you, don't just be sitting and eating. By the time you come out of COVID, you have gained, I don't know, 40 pounds. Find something to do. You can wear your mask and walk around the neighborhood, exercise your joints, continue taking your medication, do something good, help your neighbor, do something. Find something to do. Just don't sit at home and do nothing. So, really, I don't know which disease I didn't touch. I touched that. For the people with addiction, this is the worst time because you are home, you are tempted, but why are you going to the street to look for for stuff? So my whole thing is, just like I said, stay busy. Stay busy. Find something to do. That is all, guys. That is all. I talked so much. That's all, guys. That is all, guys. I wish you well. If there's something I didn't talk about, if there's a diagnosis you have that I didn't talk about, how you can keep it, let me know. Jump into my inbox. I wish you well. Continue keeping safe. Continue protecting yourself. Continue being your best advocate. I'll come with a story and tell you, one day I went to the hospital. They almost did for me a different procedure, which was not the one I went for. So sometimes my big mouth helps. Because I saw this doctor, I was like, you're not the doctor who was supposed to check on me. Why are you trying to put a scope on me? No. What's your name? And then we realized that it was the wrong chart. So, being your own advocate is so key. Is so key. Guys, I love you. I've got to go to work. Share. If there are topics that you need me to talk about, I am more than willing to talk about. I've got to go to work. I love you guys. Enjoy your very own Dr. Pamela Obare, USA. All the way from USA, from Nyamagesa. Keroka Kisi Nyamagesa. Okay. Twende kazini. Thank you guys. I love you. Bye.